Based on research that I commissioned from the Oireachtas Library and Research Service, we have somewhere between 145,000 and 300,000 cases of long COVID in Ireland, with a surge of these cases now presenting on our already overwhelmed health service as a result of the spread of the Omicron variant late last year. And Minister, I'm really concerned that our health service is actually sleepwalking into a potential avalanche of chronic illness cases as a result of long COVID.
Thank you, Deputy, for this important question, and can I acknowledge your ongoing advocacy and work on this issue. I'm committed, and Government is committed, to ensuring that those suffering from long COVID receive the full supports that they need. I met with patients attending a long COVID clinic in Tallaght University Hospital a few months back, and it was very, very sobering hearing firsthand from them the huge deterioration in their ability to live their lives and the symptoms that they're dealing with. We know that long COVID, as of now, the advice I have, can be experienced through about 50 different symptoms at the moment, and that includes the most common being fatigue, weakness, breathlessness, anxiety, difficulties with memory and concentration, and musculoskeletal pain, and a lot more. So really very serious symptoms. Anyone concerned with long COVID, Deputy, is advised in the first instance to go to their GP. And the GP can refer them where needed for specialist care. There are services in place, and critically, I think to your question, Deputy, we are expanding these services. The HSE has developed and is implementing an interim model of care to provide long COVID services nationally. 2.2 million has been allocated directly for that. It involves services across a number of healthcare settings, including GPs, community and hospitals. The initial priority is to establish post-acute and long COVID clinics within each of the hospital groups. The HSE has advised that the post-acute clinics are managing between 4 and 12 weeks after initial onset of infection, and the long COVID clinics are managing patients 12 weeks post onset of infection. The clinics are established as part of a new interim model of care, and they're operational in 4 of the hospital groups, and work is ongoing to establish the additional clinics and links with the other hospital groups and the other clinics to ensure that we have a national network, which obviously is something we need, and I want to acknowledge that you have been calling for.
Minister, look, I welcome that these post-acute and long COVID clinics are being established. But we're a long time waiting for them to be established, Minister. I was promised these last September that they would be put in place. And we're being told that until the clinics are put in place at hospital level, there won't be a network back to the GPs. Now, you've already provided advice here this morning that people that are experiencing long COVID should go to their GPs. The GPs are overwhelmed at the moment. It's impossible to get an appointment with the GP. When you go into a GP, they don't have the data. When the GP sends someone for a test, the test is not showing up any indication of long COVID. There is no proper referral pathway into the acute hospital system. Even when they get into the acute hospital system, there is no testing or procedures in place, and the clinics are only available in a handful of hospital settings.
Thank you, Deputy. Minister.
Thank you, Deputy. So you were told last September, I accept that, and since then, so a lot has happened and clinics have been set up. I know you'll appreciate that given the immense pressure that our hospital system is under, that our healthcare professionals, they are working as quickly as they can. So as I said, there's an interim model of care which is looking at 2 different things: post-acute and then long COVID after that. And I think, as you quite rightly say, Deputy, we need them in all of the hospital groups. We have them in 4. We're establishing them in the rest as quickly as we can. And then there is going to have to be more engagement. I think you're quite right with the GPs, with primary care, with the ICGP, to make sure that the resources are available to the GPs, that the protocols are available, that the training is available, and critically, where the GPs in some instance may be able to provide care, that when they refer their patients on, that there is that specialised service available for them.
But, Minister, the difficulty is that we are now experiencing an avalanche of these cases. Somewhere between 1 in 5 and 1 in 10 people that have had COVID end up with long COVID. They're presenting at GP surgeries at the moment, and there is no referral pathway in place for the vast majority of people in this country at the moment. We're looking at a minimum of 145,000 people added on top of the 1,610 people that are already within hospitals suffering acute COVID today. Now, Minister, in the responses that I have received, and numerous responses that I've received from the HSE is saying that they're going to build on the existing level of service provision that's there. Now, anyone that has suffered from ME or chronic fatigue syndrome will tell you there aren't the services there at the moment, so we're building on very dangerous foundation.
Minister to conclude.
Thanks very much for that, Deputy. So in terms of the approach and the clinical approach the HSE is using right now, so the HSE at the moment is using the UK NICE or NICE guidelines in defining long COVID. So what they're saying is it's symptoms that develop during or after an infection consistent with COVID-19 persisting beyond 12 weeks and that are not attributable to a different diagnosis. There is, Deputy, and I know you're aware, there is a lot of uncertainty still in the international literature in terms of how many people experience prolonged symptoms. However, the initial indications we have, as you quite rightly say and have consistently said, are very sobering. So the published international reports, while they vary, our best current understanding is that between 10 and 20% of COVID-19 patients experience lingering symptoms for weeks or sometimes months. So as you rightly say, it is a very significant number of people. What the clinicians are working through at the moment is what portion of them are going to require ongoing clinical supports, and there's both a patient registry and an epidemiological survey which the HSE are putting in place now to help with that.